Every ancient civilization we have covered on this channel had one problem in common: pain. Headaches, joint pain, back pain, muscle soreness, toothaches, menstrual cramps, post-surgical pain, chronic inflammation, and every single one of those civilizations developed plant-based solutions centuries before the first painkiller was ever manufactured in a laboratory. Here is what modern research has revealed. Several of those ancient pain remedies have now been tested head-to-head against modern pharmaceutical painkillers, and the results are not what you would expect. In clinical trials, some of these plants performed as well as ibuprofen. Others matched prescription-strength drugs like Vioxx and lorazepam, and almost all of them had fewer side effects. This is educational content, not medical advice. Always consult a qualified healthcare professional before using any herbal remedy, especially if you are taking prescription pain medication. Today we are covering 20 plants that ancient healers used for pain, and what modern research actually shows. Stay until the end, because number 20 is a compound so powerful that it tricks your brain into shutting off pain signals entirely. If you love discovering the hard science behind ancient remedies, make sure to hit the subscribe button so you never miss a video. Let us begin. The joint and back pain fighters. Number 1. Turmeric, the golden anti-inflammatory. We start with the most researched anti-inflammatory plant on Earth, and we start with it because the clinical data here is extraordinary. A 2014 randomized clinical trial, published in Clinical Interventions in Aging, took 367 patients with knee osteoarthritis and split them into two groups. One group received 1,500 milligrams of turmeric extract daily. The other received 1,200 milligrams of ibuprofen daily. After 4 weeks, both groups reported the same level of pain reduction. The turmeric group had fewer gastrointestinal side effects. The active compound curcumin blocks COX-2 enzymes, the exact same inflammatory pathway targeted by ibuprofen, naproxen, and other non-steroidal anti-inflammatory drugs. The difference is that curcumin does this without the stomach lining damage that makes long-term use of non-steroidal anti-inflammatory drugs dangerous. Combine with black pepper to increase absorption by 2,000%. Number 2. Boswellia, the Indian frankincense. If you watched our Ayurvedic video, you know this one. A 2018 review in Arthritis Research and Therapy found that Boswellia serrata extract has anti-inflammatory effects comparable to conventional non-steroidal anti-inflammatory drugs. Without the stomach damage, boswellic acids inhibit 5-lipoxygenase, a key enzyme in the inflammation cascade. Studies have used 300 to 1,200 milligrams per day. Number 3. Devil's Claw, the African pain root. Devil's Claw, Harpagophytum procumbens, is native to the Kalahari Desert in southern Africa and has been used by San and Khoi healers for centuries to treat pain, fever, and digestive problems. The plant gets its name from the claw-shaped hooks on its fruit. A Cochrane-referenced review analyzed multiple high-quality trials and found strong evidence that Devil's Claw reduces lower back pain. In one trial, 60 milligrams of Devil's Claw daily reduced pain as effectively as 12.5 milligrams of the prescription drug Vioxx. In another trial, a standardized dose of 100 milligrams outperformed placebo significantly for both pain and mobility. The active compounds are harpagosides, which modulate inflammatory pathways in the spine and joints. A plant from the Kalahari Desert matching a prescription painkiller that was later withdrawn from the market due to cardiovascular side effects. The plant is still here, the drug is not. Number 4. Ginger, the muscle soother. Ginger does not just help with nausea. A 2010 study published in the Journal of Pain found that daily ginger consumption reduced exercise-induced muscle pain by 25%. A separate study found that ginger was as effective as ibuprofen for reducing menstrual pain. The compounds gingerol and shogaol work on 3 pain mechanisms simultaneously, blocking inflammatory compounds, reducing pain signal transmission, and improving circulation to speed healing. Number 5. Nettle, the sting that heals. This one sounds counterintuitive. Stinging nettle causes pain on contact, but when taken orally or applied as a cream, it reduces joint inflammation. A 2013 systematic review found evidence that nettle leaf extract reduces inflammatory markers associated with arthritis. Some traditional practitioners still use the fresh leaves to deliberately sting arthritic joints. The practice is called urtication, and it has preliminary evidence for temporarily reducing joint pain through counter-irritation. The headache and nerve pain remedies. Number 6. Willow bark, the original aspirin. Every civilization used willow bark for pain. The Ebers Papyrus documented it around 1550 BC. Hippocrates prescribed it in Greece. Native Americans chewed it across North America. Chinese physicians used it independently. It is one of the few plants that appears in the medical texts of every civilization we have covered on this channel. A standardized daily dose of 240 milligrams of willow bark extract reduced back pain as effectively as Vioxx in a moderate quality clinical trial. Unlike Vioxx, which was removed from the market for causing heart attacks, willow bark has been safely used for over 3,000 years. The compound salicin is converted to salicylic acid in the body. That is the same chemical pathway that Bayer turned into aspirin in 1899. Willow bark causes fewer gastrointestinal side effects than its pharmaceutical descendant, because it releases salicylic acid gradually rather than all at once. Number 7. Feverfew, the migraine herb. Feverfew, Tanacetum parthenium, has been used since ancient Greece and Rome for headaches, fever, and inflammation. A 2015 Cochrane review analyzed multiple trials and found that Feverfew reduced the frequency of migraine attacks compared to placebo. Parthenolide, the active compound, inhibits serotonin release and reduces platelet aggregation, both of which are involved in migraine pathology. Number 8. Butterbur, the headache preventer. Butterbur, Petacites hybridus, was used in medieval European medicine for plague, fever, and headaches. In 2012, a study found that Butterbur extract reduced migraine frequency by 48% compared to placebo. The American Academy of Neurology previously gave Butterbur a Level A recommendation for migraine prevention, the highest possible rating. Important note, use only pyrrolizidine alkaloid-free Butterbur products, because the raw plant contains compounds that are toxic to the liver. Number 9. St. John's wort, the nerve pain herb. We covered this in our Greek remedies video for its antidepressant effects, but research also shows it has analgesic properties. The compounds hyperforin and hypericin inhibit the reuptake of serotonin, norepinephrine, and dopamine, and interact with GABA receptors. This combination makes it useful not just for depression, but for neuropathic pain conditions. Number 10. Peppermint, the tension headache cure. A 2016 clinical study found that topical peppermint oil applied to the forehead was as effective as acetaminophen for reducing tension headache pain. The compound menthol activates cold receptors in the skin, creating a cooling sensation that interrupts pain signal transmission. Applied topically. No pills, no side effects. We are past the halfway point. And the remaining plants target the kinds of pain that modern medicine still struggles to treat effectively. The tooth, mouth, and throat healers. Number 11. Clove, the dental anesthetic. Clove, Syzygium aromaticum, has been the go-to toothache remedy for virtually every civilization on Earth. The active compound eugenol is a natural anesthetic and antiseptic. It is so effective that eugenol is still used in modern dentistry today in dry socket dressings and temporary filling materials. A study in 2006 found that clove gel was as effective as benzocaine, the standard topical dental anesthetic, for reducing needle insertion pain. Number 12. Mirk, the ancient mouthwash. In our Egyptian and biblical videos, we explored myrrh for wound healing, but its analgesic properties are equally well documented. Myrrh contains terpenoids with demonstrated pain-relieving and anti-inflammatory effects. A myrrh tincture diluted in water is still used as a therapeutic mouthwash for oral pain, gum inflammation, and mouth ulcers. Number 13. Sage, the sore throat remedy. A clinical trial published in 2006 in the European Journal of Medical Research found that a sage and echinacea spray was as effective as a chlorhexidine-lidocaine spray for treating acute sore throats, an herbal spray matching a pharmaceutical spray that contained a local anesthetic. The women's pain specialists. Number 14. Black cohosh, the cramp reliever. We covered black cohosh in our indigenous plants video. The Cherokee and Algonquin used it for menstrual cramps and menopausal symptoms. A Cochrane review found evidence that it reduces menopausal hot flashes. The German Commission E approved it for menstrual pain and premenstrual discomfort. Number 15. Dong Quai, the female painkiller. In our Ottoman and Chinese videos, we explored Dong Quai as the female ginseng. The compound ligustulide has anti-spasmodic effects that relax uterine smooth muscle, which is why Chinese physicians have prescribed it for menstrual pain for over 2,000 years. Number 16. Cramp bark. The name says it all. Cramp bark, Viburnum opulus, was used by Native American tribes and European herbalists, specifically for muscle cramps and menstrual pain. The name is literal. It contains viopudiol and scopolamine, compounds with demonstrated anti-spasmodic and muscle relaxant effects. Traditional preparation involves simmering 2 teaspoons of dried bark in water for 15 minutes. Number 17. Arnica, the bruise eraser. Arnica montana, has been used in European folk medicine for centuries for bruises, sprains, and muscle soreness. A 2010 systematic review found that topical Arnica reduced pain and bruising from injuries as effectively as topical anti-inflammatory drugs. Important: Arnica is for external use only. Internal consumption is toxic. Number 18. Comfrey, the bone knitter. Comfrey, Symphytum officinale, was called knit bone in medieval Europe because healers used it to speed the healing of fractures and sprains. A 2012 clinical trial found that topical comfrey extract significantly reduced ankle sprain pain compared to placebo. The active compound allantoin stimulates cell proliferation and accelerates tissue repair. Like Arnica, comfrey is for external use only. Number 19. Lavender, the pain-calming oil. In our Roman herbs video, we covered lavender matching lorazepam for anxiety, but lavender also has direct analgesic effects. A study in 2015 found that lavender aromatherapy significantly reduced pain intensity in post-operative patients. Additional studies have shown benefits for migraine pain, menstrual pain, and chronic pain conditions. Linalool interacts with both the nervous system and the inflammatory response simultaneously. Number 20. Capsaicin, the pain paradox. I told you at the beginning that number 20 tricks your brain into shutting off pain signals. Here is how. Capsaicin is the compound that makes chili peppers hot. It has been used topically for pain across the Americas and Asia for centuries. Aztec healers applied chili paste to toothaches. Chinese physicians used it for joint pain, and Ayurvedic practitioners included it in warming pain balms. When applied to the skin, capsaicin initially causes a burning sensation. But then something remarkable happens. Capsaicin depletes a neurotransmitter called substance P from the nerve endings in the treated area. Substance P is the chemical messenger that sends pain signals to your brain. When it is depleted, the nerve can no longer transmit pain. The pain signal is literally switched off. Think about what this means. A compound from a chili pepper does not mask pain like a painkiller. It does not reduce inflammation like a non-steroidal anti-inflammatory drug. It actually removes the chemical your nerves need to report pain in the first place. This is not speculation. Capsaicin cream is approved by the FDA to treat neuropathic pain, post-herpetic neuralgia, and diabetic peripheral neuropathy. High-concentration capsaicin patches, sold under the brand name Qutenza, are prescription medications used in pain clinics worldwide. A single application can provide pain relief for up to 3 months. A compound from a chili pepper is now a prescription painkiller used in hospitals. Ancient cultures across the Americas and Asia used chili peppers topically for pain for centuries before anyone understood the neurochemistry of substance P. They did not know why it worked, but they observed that it did. And they were right. And that completes our journey through 20 plants that ancient healers used for pain. From turmeric matching ibuprofen for knee pain, to devil's claw matching Vioxx for back pain. From peppermint oil matching acetaminophen for tension headaches, to capsaicin becoming a prescription painkiller, the pattern is consistent. Ancient healers identified plants that target the exact same biochemical pathways that modern painkillers were designed to block. COX enzymes, 5-lipoxygenase, substance P, GABA receptors, serotonin reuptake. They did not have the vocabulary, but they had the observation. And observation, it turns out, was enough. If this changed the way you think about pain management, subscribe to the Green Domain. Because next, we are investigating the herbs that appear across every ancient civilization on Earth. Drop a comment and tell me which pain remedy surprised you the most. And if you missed any of our civilization videos, all the links are in the description. Ancient wisdom, modern proof, real results. I will see you in the next one.